great day to talk rehab. Thanks for tuning in. I'm Dr. Donald DeFabio. Today we're going to talk about a very interesting syndrome that is really a home run when you find it and treat it because the symptoms are sometimes a little hidden. You have to look farther away. And that is the inability to extend the big toe, to have the big toe go up. You would think if you can't extend your big toe, have it come up, there's going to be a problem with the joint here, hallux rigidus, or there might be a problem in the foot with a plantar fasciitis. But sometimes, and it's not that unusual, it's actually a problem with the flexor hallucis longus, which is a muscle that starts right about here on the outside of the leg. All right, about a third of the way down the leg, and it comes down this way, wraps around the back of the ankle, and goes to the big toe. A little ticklish there, Mike. Sorry about that. Say hi to everybody, Mike. He's got ticklish feet. So it comes around like that, and it's very deep, and it ends up on the big toe. So when you extend the big toe, if this doesn't stretch because it's inflamed or if it's tight, it's going to be painful in the big toe. But the problem oftentimes is the belly of the muscle is strained or it's just tight and knotted up. And like I said, it's a deep muscle. How are you going to get your hands on it? How are you going to manipulate through that? One of the best ways to treat the flexor hallucis longus, with the dysfunction being you can't extend the great toe, radial pulsed wave therapy, shock wave. So it penetrates nicely, it gets into the target tissue, and it works really well. So what do? We have diagnosed the condition, and we know there might be some tenosynovitis in that common, not in the tendon, it's not a common tendon, but it wraps around in the medial aspect of the ankle, you know, by the posterior tibial and the flexor digitorum longus. And then there's that flexor hallucis longus, Tom, Dick, and Harry is the mnemonic. On the inside, those tendons can get inflamed, but let's work the belly. It's deep, so we need some penetration. I would do about 1.4, 1.5 bar, and I would bring him down to about 15 hertz, okay? And let's see how that feels. And it's right behind the fibula, right behind the bone, so you won't want to go on the bone, you want to get behind it. So, Mike, how does that feel? Any sensitivity in there?
A little bit.
On a scale of 0 to 10, what would you give it?
3.
3.
Yeah.
So, if that was really knotted up with Mike, I would probably go a little bit more, 1.7 bar. We don't want to get him more than 6 out of 10. 5 out of 10 is usually adequate. How about now?
That's about a 5.
It's about a 5. So, guess what? We don't want to do more than that. I don't want to go right on the bone. I want to get the muscle behind the bone. How about over here?
About 5, I would say.
Over here?
Nothing.
Nothing. So even though there's nothing, he didn't feel any pain when I was down here. He felt some discomfort when I was up here. But the radial wave will reach up here, so I can just treat him down here, and we're still going to get a release of the belly of the flexor hallucis longus. So by treating this with the radial pulse wave, it relaxes it. We can get into the myotendinous junction. I do not follow it into where the tendon comes into the medial aspect of the medial malleolus. It's way too superficial. It's not going to like that. You want to do a little bit over the plantar fascia, you can, but working it through here is your money when it comes to treating tightness and irritation of the flexor hallucis longus. Radial pulse wave therapy works great, and yeah, the Chattanooga Mobile RPW is a great way to get the job done. I'm Dr. Donald DeFabio. It's been a great day to talk rehab, and I'm going to finish up with this therapy. We'll see you on the next video.